Hi, everyone. Thanks so much for joining us. My name is Chrissy Giuliano. I'm the director of the Big Cities Health Coalition. You should all be able to see slides online. And again, as those of you just heard, I'm recording both the audio and the slide cast, just so everybody is aware. I will briefly walk through some slides, demonstrate the data platform, and then take questions. My preference would be to take questions at the end, but if you have a real urgent question, clarifying question while we're going through the slides, please feel free to put it into the chat box, and I will answer it as soon as I can. So, the Big Cities Health Coalition, or BCHC, was founded more than a dozen years ago to provide a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of the residents they serve. Our mission, is to advance equity in health for present and future generations, and the vision is to create healthy, more equitable communities through big city innovation and leadership. Our membership criteria, in short, is that you have to be both urban and large. And on this map, you can see our 28 member cities. BCHC is made up of the lead local health official from each of these local health departments. And collectively, our jurisdictions impact more than 54 million people, or 1 in 6 Americans. I want to start by thanking our partners in this work. Funding for the project comes primarily from the U.S. Centers for Disease Control and Prevention through a cooperative agreement with NACCHO, the National Association of County and City Health Officials. I'd also like to thank the De Beaumont Foundation and the Robert Wood Johnson Foundation, both of whom provide additional support for the project as part of their ongoing support of the coalition as a whole. I also am immensely grateful to the many experts who weighed in on this project, most especially our member cities' staff, who provided data and guidance in this process, along with those funders and partners that I mentioned. Without all of them, this work could not have been done. So I'm sure many of you know public health is the science of promoting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious disease, among other things. Importantly, metropolitan areas are now home to almost 83% of Americans. So why city-level data? I can't emphasize enough that effective public health practice, again, as many of you know, depends on having reliable and current information regarding the health of every community. Without it, policies can neither be targeted to those populations most in need, nor can the impact of policy change be measured. Data is critical to partnerships with community-based organizations, clinical providers, and a host of governmental agencies. Most national data on health status, however, makes comparisons at the state level and sometimes the county level. Leaders across the spectrum have expressed a continuing need for more comprehensive data and comparable perspective on the most pressing health issues facing the nation's urban areas. Many cities struggle with significant health disparities, but often lack the information needed to help the public, policymakers, and even others in the health field tackle key winnable health battles. Further, particularly regarding emerging public health problems, data points collected across cities can vary and often cannot be effectively compared. We are addressing this problem by using comparable practical definitions of key health indicators through a standardized data collection process to allow comparability across jurisdictions. So the data tool provides a snapshot into the state of urban public health. The more than 17,000 data points can be compared across cities. As a cross-section of big urban areas or cities, these populations are more alike than they are different. The platform is a unique resource for a number of different constituencies, and now it's even easier for users to find out how city populations are faring on some of the biggest public health challenges of our time. In all, the tool features over 17,000 data points, including more than 50 health and socio-demographic indicators. The data set is the first of its kind to provide these data in a comparable manner at the city level. Excuse me. For the most part, the health indicators included on the platform have come directly from the cities themselves. Some key exceptions are preschool enrollment and high school graduation rates, as well as a number of the other demographic indicators, and those come from publicly available data sets using standardized city codes. While those codes do not always track jurisdictional lines exactly, they do give us the best data available for a number of indicators. So as I mentioned, we don't want to compare apples and oranges, and to the best of our ability, we've used standard definitions and adopted a methodology that allows for comparability across cities. For the most part, we left out data that are not fully comparable. More information on that can be found on the methodology page of the website. That also includes a glossary of some of these terms, and I'll show you that when we move over to look at the platform. In short, we made decisions about whether to use, for example, age-adjusted versus crude rates according to the standard practice and with guidance and support of our advisory committee of city experts. So the platform was designed to be understandable and accessible for anyone who wants to explore the state of public health in urban America. It can also be used as a tool to help policymakers prioritize scarce resources with these data. Providing access to the data is the best way to expand and improve upon it, and we encourage outside use and analysis. And I'm going to show you that you can actually download the entire data set of the 17,000 plus data points. You can also, on the platform, sort the data by health indicator or city, excuse me, and then by race, ethnicity, or sex. And then the data charts that you create can be easily shared directly to social media or downloaded in a number of different formats. So for the first time, it's pretty easy for cities to look across the spectrum at their peers and determine who's ahead of the curve and start to ask why. So now, hopefully, with the wonders of technology, we will share. So I'm going to, excuse me, full-size this on my screen, but you may need to also full-size it on your screen, and I'm going to redo the share here so that sometimes it chimes out on me. Share my screen. We won't share my email. Let's see. Here it is. Okay, so that'll take a minute to come up. Again, you'll need to probably hit full screen, which is those four arrows pointing in various directions so that you can see clearly. There are a couple glitches also as I show this to you. You don't always see everything that I want you to see, but I'll walk you through that. So this is our main website, the Big Cities Health Coalition website. You get to the platform by clicking on City Data. And then you can enter the data platform. So as you can see, down the left-hand side here, we have our indicator categories. You can expand the various categories to see what indicators are there. Down below that, we have our list of cities. Again, there are 28 member cities. And so you can select a city, and then data will pop up for that city. Also, down here on the bottom of the page, you can get to the data and methodology that I mentioned, and also download the complete data set. I'm going to pause for 1 minute to answer a question that somebody is sending so that she has the information with dial-in. So hold on. Okay. So you can then go back up to the top here, and this is where the display doesn't always work perfectly at Adobe Connect, but I want to draw your attention to this bar up here. So this is how you filter any of the records. And you can pull down and see that's what's not working, which is odd because sometimes it does. So when you pull down on this, if you do it on your own computer rather than through Adobe Connect, you'll get the list of indicators for each city, so both the category and the list. And it only includes those categories for which we have data for those cities. So basically, as I'm pulling down Boston now, while you can't see it because you see your little blue triangles and squares, it's showing me all the indicators for Boston. So you can select an indicator and then go over to the year, and you could say select all, and then do the same with sex, which, again, we're getting weird blue squares, but basically you have both female and male as your options. And then race and ethnicity. And again, there's 6 or 7 options of various race and ethnicity categories. I'm going to keep it as all. And then I'm going to filter. And then you're going to get your new data. There are also notes at the bottom of the page regarding the city or the indicator. The other thing I want to share with you all is that this download function that I mentioned. So again, you can download the complete data set down here, and that's all the data points for all the cities. This city CSV up here, that will download an Excel spreadsheet for Boston with any data that you're seeing on this page. So % of low birth weight babies born. All those data points would be in the CSV. If you wanted to share the image, you can do that in a number of ways. You could tweet it, you could bring it over to Facebook, and then you could also download the image in a number of various size options depending on what you need that information for. So I'm going to go back to the So in a nutshell, that is Big Sue's Health Data Platform. I want to, again, thank everybody for joining. I know some of you were supposed to be on last week, and there were some technical glitches, so I appreciate you joining us. We're also going to put this recording on our website so that those others who couldn't join can hear the information. So if there are questions, I'm happy to answer them either via the chat or we're a pretty small group. We can do it over the phone. So please feel free if you have questions. And I'm going to type my contact info into the chat box specifically. This is the big cities info, but I'll put that in too so that everybody has that. So any questions? Well, I'm happy to stay on for a few minutes if folks are thinking about questions or if others join us. But if you have heard what you came to hear, thank you for your attention. I appreciate it. Have a wonderful holiday. And again, if people have specific or generic questions, please feel free to let me know either now via the chat or the phone, or at a later time you can send me an email. So thank you all very much.